is Albuterol, and this is my autobiography of drugs. My generic name is albuterol sulfate, and my brand names are Acne Pro Air, HFA, Prevental, Prevental HFA, Ventolin, Ventolin HFA, Ventolin Oral Liquid, and Bossfire ER. My chemical name is 4,2-third butyl amino 1-hydroxyphyl 2-hydroxymethyl and phenylsulfuric acid. My drug classification and therapeutic is adrenergic, while in pharmacologic is bronchodilator. My mechanism of action is that I act on beta-2 adrenergic receptor to relax the bronchial smooth muscle. I am also inhibit the release of immediate hypersensitivity mediators from cell, especially mast cell. I have also an effect to beta-1 adrenergic receptors, although I have minimal and has little effect on the heart rate. At least one specific study that used immunoliposomes to deliver to oxytocin receptor and have shown to abate uterine contractions. My pharmacokinetics during absorption after the oral inhalation appears to be absorbed gradually over several hours from the respiratory tract. However, dose is mostly swallowed and absorbed through the GI tract. And during distribution, it doesn't cross the blood-brain barrier. And in metabolism, I extensively metabolize and deliver the inactive compounds, and in elimination, I rapidly excreted in urine and feces, and after the inhalation, 70% of those is excreted in urine and change and has metabolites within 24 hours and 10% in feces. Half-life is about 4 hours after oral administration, and 75% of those is excreted in urine within 72 hours as metabolized 4% in feces. My indication is that most of the sympathomimetics used as bronchodilators are beta-2 selective adrenergic agonists, and that means that at therapeutic level, their action are specific to the beta-2 receptor found in the bronchi, and specifically as lost at higher levels, and other systemic effects that include increased blood pressure, increased heart rate, vasoconstriction, and decreased renal and GI blood flow, and all action of the sympathetic nervous system. The overall effects limit the systemic usefulness of these drugs in certain patients. The prototype drug is a drug of choice in adults and children for the treatment of acute bronchospasm, including the caused by anaphylaxis. It also available for inhalation because epinephrine is associated with systemic sympathomimetic effects, and it is not the drug of choice for patients with cardiac conditions. My contraindications are: first is I am contraindicated or should be used with caution depending on the severity of the underlying condition, and condition that would be aggravated by sympathetic stimulation including cardiac disease, vascular disease, and arthritis, diabetes, and hyperthyroidism. I am also should be used during pregnancy and lactation only if the benefits to the mother clearly outweigh potential risk to the fetus or neonate. An adverse effect in central nervous system is restlessness, apprehension, anxiety, fear, central nervous system stimulation, hyperkinesia, insomnia, tremor, drowsiness, irritability, weakness, vertigo, and headache. While in CVIS, cardiac arrhythmias, tachycardia, palpitations, PVCs, and angina pain, dermatologic is sweating, pallor, flushing, while in GI is nausea, vomiting, heartburn, unusual or bad taste in mouth. Then, and respiratory is respiratory difficulties, pulmonary edema, coughing, bronchospasm, paradoxical airway resistance with repeated exercise use of inhalation preparations. My nursing responsibilities is before as you have to assess the appropriateness of the medication practices by considering the patient dedication of the environment. Second is assess for the mentioned above cautions and contraindication to prevent any untoward complications. Third is discuss with the patient the medicine to give and gain verbal consent to administer the medication. Fourth is administer the medication by the oral dosage form, syrup, tablets, adults and children older than 12 years of age 2 or milligrams, taken 3 or 4 times per day. Ensuring is, first, as you have to monitor the therapeutic effectiveness, which is indicated by significant subjective improvement in pulmonary function within 6 to 90 minutes after drug administration. Second is monitor for signs and symptoms of fine tremor in fingers which may interfere with precision handwork and central nervous system stimulation, particularly in children to 6 years old, hyperactivity, excitement, nervousness, insomnia, tachycardia, GI symptoms, and report promptly to physician. Third is laboratory tests such as the periodic ABGs, pulmonary functions, and pulse oximetry. Fourth is consult physician about giving last albuterol dose several hours before bedtime if drug-induced insomnia is appropriate. After is review directions for correct use of medication and inhaler. Second is avoid contact of inhalation drug with eyes. Third is do not increase number of or frequency of inhalations without advice of physician. Fourth is notify physician if albuterol falls to provide relief because this can signify worsening of pulmonary function and reevaluation of condition or therapy may be indicated. That would be all. So I hope you're learning something and thank you for watching. Bye.